Here is a slide of a breast in a pregnant woman. It's called hyperplasia of pregnancy. In a way, this is kind of a misnomer because hyperplasia is often thought of as being a reaction or abnormal reaction to some type of process. In this case, this is a normal breast that normally undergoes hyperplasia with pregnancy. A good rule of thumb is to look at the blue areas, which are the lobules and the acini in the lobes, and compare them with the pinker stroma. So here are the glands, and here is the stroma. Normally, for purposes of rule of thumb, let's just say it should be about 50-50. Now, in a woman who is postmenopausal or atrophic, there will be a lot more stroma, or the pinker area, than there will be glands. In a person who is premenopausal and non-pregnant, let's say the ratio should be about 50-50. In here, you can see the lobular areas are generally more common than the stromal areas. So let's say that this is 60 or 70%. Of course, in a lactating woman, it may be 90% glands and very, very little by way of stroma. So let's blow it up a little bit. And remember, these areas of glands, which are separated by relatively thin amounts of fibrous tissue, are called lobules. The actual acini are the glandular units themselves. So this can be called an acinus. This can be called an acinus. This can be called an acinus. Here and here could be called an acinus. But the whole thing is a lobule. And you could see here that there is probably more by way of glandular lobules than there is stromal connective tissue. So this is totally consistent with hyperplasia, which is a normal type of hyperplasia of pregnancy. Also notice that there is very little by way of secreted milk material within these acini. There may be a little bit, but for the most part they're not distended like thyroid follicles with milk. So although this is a pregnant breast, there is probably not a significant amount of lactation here. That's all I want to say about this case.